So welcome back. We're going to talk about adrenergic antagonist. Okay, adrenergic antagonist. So they are drugs that act antagonistically on the adrenergic receptors. Okay, the alpha and beta receptors. So they will antagonize the effects of the agonist. So the effects of the sympathetic nervous system can be inhibited either by one of three ways. Okay, number one is by reducing sympathetic outflow from the brain. Here, reducing sympathetic outflow from the brain. So that's one way of inhibiting the effects of sympathetic nervous system. Number two is suppressing release of norepinephrine from the terminals. Okay, if you suppress the release of norepinephrine, you suppress the release of noradrenaline from the terminals, so you can inhibit the effects of the sympathetic nervous system. So the third way is by blocking postsynaptic receptors. Okay, blocking the receptors. So this is the most obvious one, that is to block the postsynaptic receptors. If you can block the postsynaptic receptors, then you can block, or you can inhibit, you can stop the effects of the sympathetic nervous system. So there are three ways: reducing sympathetic outflow from the brain, okay, reducing sympathetic stimulation from the brain. Number two, suppressing the release of norepinephrine from the terminals, or by blocking, stopping, inhibiting the receptors postsynaptically. Okay, so adrenergic antagonists, they reduce the effectiveness of sympathetic nervous stimulation and also the effects of exogenously administered agonists, okay, such as isoproterenol. Okay, so that's how they act. They reduce the effectiveness of sympathetic nervous stimulation and also the effects of exogenously administered agonist. So logically, they are divided into two. One is the one that blocks the alpha receptor. So they are known as the alpha receptor blockers or the alpha receptor antagonist. Secondly, we have the beta receptor blockers or the beta receptor antagonist. So first we have the central blockers. Alpha-2 agonist reduce sympathetic nerve activity. Okay, alpha-2 agonist reduce sympathetic nerve activity, and it's used to treat hypertension. Okay. Alpha-2 receptor activation blocks sympathetic outflow from the brain and also the release of norepinephrine from nerve terminals. Okay. So these drugs, they, even though they are agonists actually, but their action is like an antagonist. Okay, so their effects are considered antagonistic to the effects of alpha-2. So they block sympathetic output from the brain and also block the release of norepinephrine from the nerve terminals. Okay, look at this one. See, this is number one: reduce sympathetic outflow from the brain, suppress release of norepinephrine from terminals. So it fulfills these two criteria. Okay, it doesn't need to fulfill all criteria. It can just fulfill one of the criteria or two or all. But for this drug, this alpha-2 agonist, okay, they actually somehow they reduce the sympathetic outflow from the brain and also suppress the release of norepinephrine from terminals. Okay, so such drugs include clonidine. So if you still remember that we mentioned clonidine in the adrenergic agonist talk, so it's coming back here: clonidine, guanabans, guanfacine. Okay, and then we have tizanidine. Okay, tizanidine, which is used for treatment of spasticity. Okay, for example, for cerebral palsy patients who are spastic, they are in pain. Okay, so they need to be given something for their spasticity. So example is tizanidine. So there are many drugs actually that can have alpha blocking properties. Okay, they have alpha adrenergic blocking properties. So alpha adrenergic antagonistic effects, including antipsychotics. Okay, antipsychotics, many drugs that are used to treat psychotic symptoms of schizophrenia, bipolar disorder, and other diseases, other conditions. They will have, okay, they will have effects of alpha blocking effects. Okay, so mostly what they cause is vasodilatation. Okay, vasodilatation. So when they have vasodilatation, okay, it will eventually cause a reduction in the blood pressure. Okay, reduction in the blood pressure. So the adverse effects of these drugs include postural hypotension. Postural hypotension. Okay, so the blood pressure goes down, reduces if you change position from um, lying down to standing. So that's postural hypotension. It's hypotension. It's a lowering in your blood pressure caused by a change in your posture. Okay, in simple terms. Okay, and also reflex tachycardia. Okay, causes a reflex tachycardia. So it's we are expecting it to reduce the heart rate, but instead it causes a reflex in the heart rate increase, okay, because of the blocking effects. And then the relaxation of smooth muscle in the bladder neck and prostate helps make the urine flow better, okay, in patients with benign prostatic hyperplasia. Okay, so this kind of drugs, okay, for example, alfuzosin can be used to treat benign prostatic hyperplasia, which usually happens in the elderly males. Okay, so this is alfuzosin, okay, that is used to treat benign prostatic hyperplasia. And then we have tamsulosin and silodosin. Okay, tamsulosin and silodosin that are specific for alpha 1A. Alpha 1A. So this is the bladder. Okay, the urine flow here, the urethra, the prostatic urethra, and this is the prostate gland. Okay, the prostate gland. So in BPH, in benign prostatic hyperplasia, you have the prostate enlarging. Okay, so in order to relax this area, okay, the bladder neck and prostate. Okay, so you want to relax the muscles here so that you can have a nice outflow of urine. So you can give tamsulosin and silodosin. Okay, tamsulosin and silodosin. So these are alpha adrenergic blockers, and tamsulosin is specific for alpha 1A, and so is silodosin. Okay, these drugs are specific for alpha 1A receptors. So showing quite a similar picture as we have shown in the previous talk. So we have phentolamine and tolazolene that acts almost similarly on the alpha 1 and the alpha 2. And then we have alpha 2 antagonist, which is yohimbine, which previously had no clinical role. I'm not sure whether it has any clinical role nowadays, but previously it had no clinical role. Okay, there's nothing. You don't use yohimbine in patients to treat certain conditions. Okay, and then we have phenoxybenzamine, okay, which is somewhere towards alpha 1. Okay, and then we have the pure alpha 1 blockers, prazosin, terazosin, doxazosin, and trimazosine. Okay, so these drugs have fewer adverse effects due to its specificity. Okay, because these drugs are very specific. Okay, it has fewer adverse effects. So beta blockers, beta 1 is mainly on the heart, okay, as we have mentioned previously, and beta 2 acts on the smooth muscle of the respiratory tract, the uterus, and also the blood vessels. Okay, so that's where beta 2 acts. It acts upon the in the respiratory tract, uterus, and blood vessels, okay, the smooth muscles in these areas. So chronic administration of beta blockers will cause reduction in blood pressure, okay, and they are used, okay, beta blockers are used to treat arrhythmias, abnormal rhythms of the heart, angina, okay, hypertension, which is high blood pressure, hyperthyroidism, you have increased thyroid hormones due to many conditions, glaucoma, increase in your intraocular pressure, okay, and migraines, okay, anxiety, and beta blockers should be used cautiously in diabetics, okay, cautiously in diabetics. So because sympathetic stimulation, okay, of beta receptors leads to glycogenolysis, gluconeogenesis, and lipolysis. Okay. So beta 1 selective blockers. So if they are selective for beta 1, that means that we know that they are cardioselective. Okay, it's more prone to act in the heart. Okay, so it has more action in the heart. So beta 1 selective includes beta 1 selective drugs include Isbutalol, atenolol, betaxolol, bisoprolol, esmolol, and metoprolol. Okay, so these ones are beta 1 selective. Okay, Isbutalol, atenolol, betaxolol, bisoprolol, and metoprolol. Okay, try to remember at least atenolol and bisoprolol and also metoprolol. Okay, these are very famous drugs. And then the non-selective ones, okay, non-selective ones, we have propranolol, cartiolol, levobunolol, nadolol, penbutolol, pindolol, and timolol. Okay, so these are non-selective beta-1 blockers. So some beta blockers have intrinsic sympathomimetic activity. So meaning that they have a partial agonist, they can exert partial agonist effects. Okay, so they can be considered as partial agonist with high affinity for the receptors. This picture somehow is not related to the to beta blockers. Okay, it's just a design suggested by the artificial intelligent PowerPoint. So mixed alpha and beta blockers. We have labetalol, okay, and we have carvedilol mainly. So labetalol is often listed as a as a beta blocker, and it has with some an alpha blocking activity. Okay, labetalol. Not sure whether we have showed this in the picture. Oh, sorry, this is alpha. Okay, so I didn't show the picture, the diagram. So this drug is non-selective at beta receptors. Okay, but it's specific for alpha 1. Carvedilol is non-selective beta blocker, and it has no intrinsic sympathomimetic activity. And it also is an alpha 1 blocker. Okay, carvedilol. So in general, you have to remember at least that labetalol and carvedilol are mixed alpha and beta blockers. Okay, they are all mixed alpha and beta blockers. So we'll continue in another video. Thank you.